So Turner Construction has obviously cared about physical well-being and health for a long time of the workforce and our staff as well. More recently, we've gone down the road of active caring and showing the workforce that we care about them and we want them to go home, if not in as good a shape as when they showed up, better, if we can possibly do that. And that's where we start to kind of delve into the mental health and well-being aspect.
Turner Construction is a general contractor for a new Facebook data center outside of Des Moines, Iowa, a 40 million square foot project with hundreds of workers.
We were right there in the thick of COVID, obviously a difficult time for everybody. So we began kind of talking to our medics and talking to our health and wellness coaches and kind of trying to get the temperature of the site and see where everybody's head was at. And after we heard some of those numbers, we realized it was time for us to step up to the plate and see where Turner and Facebook could jump in to help out.
It's common for large corporations and companies to have wellness programs, and it seems that the construction industry has kind of gotten lost in that. Before, in speaking about mental health challenges and stress levels, it was more related to injury prevention and a reduction of costs and productivity. And so we're trying to change that language that we use to really support the individual as a whole. Because what the worker experiences before and after work is just as impactful to what happens during work.
So at that time we were in talks with Washington University and Anne Marie Dale and her team.
We learned that there was very high awareness among the workers. However, there was very low utilization of those services. There were a few reasons why. We learned through our interviews. Some of the reasons were the workers were concerned about confidentiality, whether others would learn about them, whether they actually had the ability to leave their workplace during work hours and receive help through the wellness coach or from the on-site counselor.
We learned at our daily stretch and flex, where we prepare for the day and provide announcements and information, that we needed to be more direct and to the point in those announcements. Additionally, one of the things the survey identified to us and put a spotlight on it was the need for information to be shared with them in the language in which they speak. We need to have a Spanish-speaking committee on the site. And currently we're doing Spanish-speaking 5-worker lunches where we bring in some of those individuals and discuss with them and see where the site can improve and what resources we can provide to them.
We sought out mental health therapists, having them on site. We looked at preventative care, so things about building resiliency, self-care, signs and symptoms of depression, and then we also looked at total health, so things down to sleep, nutrition, physical activity.
Turner and Facebook brought on experienced and educated counselors and provided a location on site for private counseling. The idea behind it being that the easier access to resources, the higher the utilization.
So if we can minimize any obstacles, right, and eliminate those obstacles and provide that resource to the worker, we're seeing participation is much higher. And we actually are having multiple people on a weekly basis come in and have those conversations with the professional and get the help that they need. The amount of conversations around mental health has increased dramatically. And not just with the workforce, but even some of our Turner staff, even people that don't sit on the site, they hear about what's going on here and they're more willing to come forward and discuss that information.
For instance, we have our foreman. Let's say that they've noticed that an individual may be struggling a little bit, they're noticing some signs and symptoms, and then they're able to connect with the mental health first aider so that that individual can receive our mental care services on site.
They trained us to recognize a mental health crisis, so to speak, when somebody's in crisis, I would say. Since I've been here, I think I've had a chance to use that. We've come across people that are clearly in some sort of mental health crisis. A lot of times you get to know them, you talk to them, and you learn a little bit about them, and all of a sudden they open up to you.
In this industry, there's still that stigma. I'm weak if I seek care. Others will look at me differently, or I don't want anyone to know.
Construction workers are, they're not going to talk about their feelings. You know, they're more the macho image, I think. So I think it's a challenge to, I guess, get them to buy into mental health.
The most important thing is to make mental health a topic that is allowed to be discussed, allowed to be brought up as a topic. So having mental health topics in toolbox talks on a weekly basis. Another very common problem in construction is there are often resources available, behavioral health insurance benefits or employee assistance programs are offered to employees, but employees are not even aware of that.
To help break this stigma is those supportive resources. So having on-site wellness programs, having mental health services on site, and then of course getting support and the buy-in from your key leaders, because they are the ones that can also provide support and to also be good examples for the individuals on site, that it's okay to ask questions, that it is okay to say, I am not okay. And so that really is important for that support and that buy-in.
Having upper management support, and not just a head nod, but actually standing up on the podium and giving the message and showing authentic interest in the topic is critical to the success of any of these. I don't think you have much chance of success without the upper management support.
Our leadership here at the site level, both Turner and Facebook, has been fully committed from the get-go. As soon as this idea was brought to them by the safety team and the health and wellness team, they were all in. Nobody batted an eye. Nobody really even had any questions. They were like, yes, this is valuable. We need to get this going as soon as possible. And they've supported that from day one. And then anytime that we've seen needs to increase staffing or resources or time, they've been fully committed as well.
For workplaces with fewer resources, there are still many things that can be done to emulate what the Turner Facebook site is doing. Educate leaders and staff about the benefits of mental health. Reach out to local and national organizations to create mental health resources, many of which are free. If possible, invest in an EAP or on-site counselor for your employees. Bring those organizations onto the site to tell employees what they can do. Train managers to recognize the signs of deteriorating mental health. The most common program is from the National Council for Mental Wellbeing and is linked in the description. Tell all employees regularly about the commitment to mental health and assure them that there won't be any repercussions for using work time to focus on their own health. Expand the commitment to mental well-being to physical well-being too, with monthly health challenges, healthy snacks, or job rotations, and ensure that paid time off is available for mental and physical health needs.
Especially when it comes to mental well-being, we know that 1 in 5 Americans is experiencing a mental health challenge. And so just think about the number of employees that you have on site. How many employees would be experiencing a mental health challenge?
From a total worker health perspective, our goal is to address a comprehensive health of the worker, which includes the physical and the mental health. And in the absence of one or the other, an individual cannot work as productively as possible. So from an economic point of view, a company would theoretically have more productive workers and benefit in that sense. But from a worker perspective, there's a much greater personal satisfaction and enjoyment in life. And the culture is much more desirable. It just becomes a more attractive workplace for the workers.
At the end of the day, in a community such as this, it's the right thing to do for the people in your community. These are parents, these are children, these are siblings of our community, and it's the right thing to do to treat them as family and ensure that we're creating an environment that not only takes care of them physically but mentally as well.